Welcome back. Today we're going to talk about flight physiology. This presentation was originally created for instrument ground, and so you'll hear a lot of references to instrument flight in it, but it applies to VFR flight as well. The reason that we focus so much on flight physiology for instrument flight is that it has the potential for having a much more serious impact on our performance.
One of the most important aspects of flight physiology as it applies to IFR operations is disorientation, in particular spatial disorientation. It is often referred to generally as vertigo. This is what will usually kill a non-instrument rated pilot during the first 3 minutes of unintended flight into IMC conditions. If you haven't experienced it yet, you will. It's a normal part of IFR flying, and you have to develop the skills to compensate for it. The brain normally takes inputs from 3 systems, the vision, somatosensory, and vestibular systems, and combines them to give us a sense of our place and movement through space around us. In IFR flight, the visual system is deprived of many of the cues that it is used to, leaving the brain open to all sorts of illusions. Since the brain relies on the visual system more than any other, we'll start with that one. The eye functions like a camera and includes an aperture, a lens, a mechanism for focusing, and a surface for registering images. Light enters through the cornea in the front, travels through a lens, and falls onto the retina. The retina contains light-sensitive cells that convert light energy into electrical impulses that travel through nerves to the brain, which interprets them as images. The light-sensitive cells come in 2 types, cones and rods. The cones are clustered near the center of the retina and are great for detecting color and high levels of detail. You can remember the words color and cones both start with the letter C. Their one drawback is they need brighter light to work well, so they aren't as effective for night flying. Rods, on the other hand, are very sensitive and can detect even low levels of light if given time to adapt. A full 30 minutes after exposure to bright light is required to get the most out of them. They are spread out away from the center of the retina, so you will get the most out of them by looking just to the side of where you want to see in low light conditions. Spatial disorientation is extremely common when pilots who are untrained or lack currency fly into the clouds, but even experienced instrument-rated pilots are subject to disorientation at times. Disorientation may cause the pilot to react to the attitude their brain is tricked into believing rather than the attitude they are actually in. That is why the first part of your IFR training will focus on how to use the flight instruments to provide your brain with the information it needs. There are a few illusions commonly experienced by pilots in IMC. The main reason for these illusions has to do with the way your inner ear works, so let's talk about that next. There are 3 canals or loops within your ear that are filled with fluid, each oriented on a different axis. When you turn your head, fluid flows through one or more of the loops. As this happens, the fluids deflect small hair cells which send signals to your brain that your attitude is changing about one of the 3 axes. Without visual references, it is impossible for the pilot to tell if the hairs in the otolith organs are being deflected due to a change in your head's position or due to the forces of acceleration or deceleration. This means you may feel like you're tumbling backwards when in reality you're just speeding up. You can use the acronym SLICES to remember all of the vestibular illusions. We're going to go through them one by one in order. The first S in SLICES stands for spirals. The graveyard spiral happens when you've been in a turn for a while and then correct back to wings level. During the turn, your ears got used to turning, so stopping the turn will feel like a turn in the opposite direction. If you're then distracted, you'll tend to roll back into the original turn thinking that you're just holding the aircraft wings level, and the nose will drop. And if you don't recognize what is happening, you may make inappropriate control inputs for the resulting turning dive. Awareness of this potential illusion is the key, and extra attention to the attitude indicator for a short time after rolling out of a prolonged turn will help you overcome it. The L in slices stands for the leans. If you roll into a turn gradually, your vestibular system may not notice it. If you roll back to level more quickly, your brain will pick that up as a turn in the opposite direction. Gentle, smooth bank changes will help you avoid this illusion, and extra attention to the attitude indicator will help you overcome it when it does happen to you. The I in slices stands for inversion. Pitching down quickly during a level off may leave you feeling as if you're tumbling backwards. Gentle, smooth changes in pitch will help you avoid this illusion, and extra attention to the attitude indicator will help you overcome it if it does happen. The C in slices stands for Coriolis. Let's say you've stayed in a turn long enough for the fluid in its canals to stop moving, causing the hairs to return to neutral. Then you drop a pencil and abruptly reach down for it, moving your head as you do so. That causes the fluid to flow unpredictably as your head moves about a different axis from that of the turn. This can leave you extremely disoriented with regard to your actual position and lead you to want to recover from a maneuver that you're not actually engaged in. Avoiding head movements during turns will help you avoid this, and extra attention to the attitude indicator for a short time will usually settle things down. The E stands for elevator. An abrupt upward vertical acceleration, as can occur in an updraft, can stimulate the otolith organs to create the illusion of being in a climb. This is known as elevator illusion. The disoriented pilot may push the aircraft into a nose low attitude. An abrupt downward vertical acceleration, usually in a downdraft, has the opposite effect. Cross-check your altitude, vertical speed, and attitude indicator often when encountering up and down drafts. The last S in slices refers to somatographic, which are illusions having to do with acceleration and deceleration. Rapid acceleration may feel as though you are pitching up, and the opposite is true for a rapid deceleration. In a high-performance aircraft, this illusion is common just after takeoff while the aircraft is still accelerating and low to the ground, and then the pilot develops the urge to pitch down. Anytime you accelerate or decelerate, pay extra attention to your flight instruments and use the attitude indicator to help overcome this illusion. Motion sickness, also known as air sickness, is caused by the brain receiving conflicting signals about the state of the body from the vestibular, somatosensory, and visual systems. This can be exacerbated by anxiety and stress. Many student pilots experience motion sickness at least once during their training. When in VMC, focusing on the horizon usually helps. In IMC, dealing with it can be a little bit more difficult. For the pilot, once again the attitude indicator is probably your best friend, and if you're single pilot, a diversion to an alternate airport may be called for. Your performance will be degraded, so if you can terminate the flight early, that's probably a good idea. However, usually by the time you're ready to fly IFR by yourself, your body has overcome this tendency. Since we fly at different altitudes, knowing about your respiratory system is important for a pilot. This is especially true if you're flying IFR, because many of the MEAs are at higher altitudes than you might choose if you were flying under VFR conditions. Your brain needs a constant supply of oxygen to function properly. It gets that through the blood via cells called hemoglobin. Oxygen attaches to the hemoglobin in the lungs and is pumped through the brain where it is used up and converted to CO2. The CO2 returns to the lungs where it is expelled. Only about 21% of the air in our atmosphere is oxygen. Hypoxia is a lack of sufficient oxygen in the body, cells, or tissues, and of particular importance, the brain. It is caused by an inadequate supply of oxygen, whether that be because there is not enough atmospheric pressure to get the oxygen to attach to the hemoglobin, a problem with the circulation in your body, or the body's inability to use the oxygen. We break these problems down into four types of hypoxia: hypoxic hypoxia, anemic hypoxia, also known as hypemic hypoxia, stagnant hypoxia, and histotoxic hypoxia. You are expected to know about all four by name. Let's look at each type. Hypoxic hypoxia is the most common type that pilots have to deal with and is most often caused by altitude when flying. You may have heard the term altitude sickness, which is another name for hypoxic hypoxia and a very real danger. The percentage of the air that is oxygen does not change with altitude, but the pressure does. It takes pressure to get the oxygen to move through the membranes in the lungs to attach to the hemoglobin. We can make up for the lack of total pressure at higher altitudes by increasing the percentage of oxygen by using supplementary oxygen. That has the same effect as increasing the pressure up to about 25 to 35,000 feet. After that, increasing the air pressure is a must, which we can do with a pressure oxygen system or, even better, cabin pressurization. Supplemental oxygen is not needed for normal operation of a pressurized aircraft, but is required for our backup. Carbon monoxide, or CO, is an odorless, colorless gas that can cause sudden illness and death. It is present in exhaust, and since we use warm air from around the exhaust pipes to warm the cabin, we need to be aware of this. Red blood cells, or hemoglobin, pick up CO 200 times quicker than they pick up oxygen. If there is CO in the air, the body may replace oxygen in the blood with CO. This blocks the oxygen from getting into the body, which means your brain is deprived of the oxygen that it needs. It can also damage tissues and would result in death eventually. Because the brain is deprived of oxygen, just like hypoxic hypoxia, the symptoms are similar. If you suspect CO is present, you should terminate the flight immediately and use supplemental oxygen if you have it. Stagnant hypoxia is oxygen deficiency due to poor circulation. In flying, this is most likely caused by high G forces, though hopefully you won't be doing that kind of maneuvering under IFR conditions. Histotoxic hypoxia is just yet another reason not to drink and fly. Even moderate alcohol consumption can add a couple thousand feet to your real altitude in terms of your brain's oxygen requirements. Histotoxic hypoxia gives a whole new meaning to the phrase getting high. This is a partial list of symptoms of hypoxia. Each person will exhibit them in a different order, but nobody is immune. The good news is that a given person will tend to get them in the same order every time. If you have the opportunity to attend one of the FAA-sponsored altitude training sessions, you can identify what your first 2 or 3 symptoms are so that you can identify hypoxia in flight quickly. We will talk about what the regulations say in a minute, but realize that you can experience symptoms of hypoxic hypoxia at lower altitudes than the regulations dictate the use of oxygen. This is especially true if you live near sea level like I do. I know that if I'm over 10,000 feet for any time, I can start to experience the symptoms, and I'm asking for a really big headache at the end of the flight. Getting to a lower altitude is the best way to address hypoxia, but it's not always possible under IFR. If you think you might be at altitudes where hypoxia could be a factor, an oxygen system is a great way to mitigate that risk. They make portable systems that are affordable now. You will want to memorize FAR 91-11, which governs when oxygen is required to be used. You need this information in your head in case ATC tries to reroute you or assign you a higher altitude. Below 12,500, no oxygen is required. You can poke your head up between 12,500 and 14,000 for no more than 30 minutes, and then you need to either be back below 12,500 or on oxygen. Above 14,000, the crew has to use oxygen at all times. Above 15,000, you also need to provide it to your passengers. Remember, these are minimum requirements. Unless you're a trained mountain climber, you should probably set your minimums considerably lower than that. Hyperventilation is the excessive rate and depth of respiration. It raises the blood's pH value, making it more alkaline, which initiates a constriction of the blood vessels that supply the brain and prevent the transport of oxygen and other molecules necessary for the functioning of the nervous system. It can happen in flight more often because there is stress there, but also at high altitudes you may be inclined to breathe more rapidly than normal. To address it, the key is to slow the breathing rate. You can just force yourself to breathe slower, but another good solution is to breathe into a paper bag. What that does is replace some of the oxygen with some carbon dioxide, and that tends to rebalance things. You can also just talk out loud. The act of talking slows your breath rate and will help solve the problem for you. Be on alert for any of these symptoms in yourself or your passengers. That might be a symptom that they're hyperventilating. It's important to be aware if either you or your passengers have been scuba diving recently before a flight, that extra precautions may be necessary. When people scuba dive, they're breathing in a mixture of nitrogen and oxygen. Under the pressure of the dive, the blood can absorb more than the normal amount of nitrogen. And then afterwards, if you go flying at the higher altitudes, that nitrogen can bubble out and cause the bends. This can be a very serious condition. Make sure that you wait these times, 12 hours for a non-controlled dive, 24 hours for a control dive for up to 8,000 feet, and above 8,000 feet, 24 hours regardless of the type of dives before you go flying. You should make an honest, accurate assessment of your fitness to fly before every flight. The I'm Safe checklist is an easy and important tool for making an assessment. Even minor illnesses that most people would attend work or school with can have a negative impact on flying. It should go without saying that drugs and alcohol don't mix with flying. Nonetheless, the news periodically carries a story of a pilot who thought they could get away with it. Whether you're talking about recreational drugs or alcohol, just don't. If you're taking prescriptions or over-the-counter medication, check with the pharmacist, your airman medical examiner, and or AOPA's master drug list to see if it's appropriate to fly with those medications. We've talked about stress already, but remember to check that you're not bringing too much life stress into the cockpit with you when you go flying. If you start with a deficit already, you may exceed your capabilities during the flight. The effects of fatigue on performance has been thoroughly studied. New studies are revealing even more about the finer points of fatigue, such as flying on the backside of the clock, where your duty time is at night when you would normally be asleep. A pilot has two responsibilities with regard to fatigue. Number one, they need to arrange their schedule and their lifestyle such that they show up for each flight ready to perform at their best. This is especially challenging for night flights. You may need to set aside some time during the day leading up to the flight to rest and, if possible, sleep so you can stay focused for the entire flight. Their second responsibility is to make an honest and accurate self-assessment of their fatigue prior to the flight and cancel if needed. Even commercial pilots. Most companies have provisions for this now, and though if it becomes a regular event, they might want to talk to you about how you're preparing for your flights. You should review your fitness to fly along with all the other risk elements associated with every flight before you decide to go. Setting reasonable personal minimums ahead of time can help you make good choices. You can find this handout in printable form in D2L.